can't be me, this can't be true. The terms skin cancer and melanoma are new to this people of my generation. We just went out in the sun in a pair of shorts and a pair of jandals, and that's what we lived, how we lived.
Just not believing they could change to a cancer, just not believing that they will get cancer.
I used to drift down the Waikato River in a pair of shorts and a shotgun when it was shooting season, nothing else, no cover up. That's all we did. That's what we knew.
The commonest form of skin cancer is the basal cell cancer, which can start relatively at a younger age. It's due to a combination of sun exposure and genetic reasons. And the second most common is the squamous cancer, which comes due to a cumulative sun damage, which we see in a relatively older population. If you ignore any changing moles or lesions which are new and getting darker or growing bigger, they can advance deeper into the layers of the skin and thereby get into the rest of the body, which could be detrimental to the life.
I thought it was static. I didn't think it was moving or changing in any shape, manner or form. My kids didn't come round at least once, twice a month or something like that. And they kept nagging me that we reckon it's getting worse, Pop, so you better do something about it. So after much pushing, I went to the GP, who then referred me to this place.
There are many different types of cancers, some more slow growing and some more fast growing. It's quite variable.
It can be
between 3 months to a year or two in case of melanomas, and the same in other cancers too.
So going to the GP initiated the whole thing. I was given I could possibly put my name down for Middlemore. That would be a waiting game, and I was told that I didn't have the time to wait, basically. Very professionally, and courteously too.
Once a cancer is diagnosed, a biopsy is done to know the type and depth of the cancer, and thereby the treatment is decided according to the biopsy results.
I think there were 2 appointments initially, and then when she realised that it was pretty serious, she sort of got me to come back, I think, the next day, on a Saturday, I think it was, and the surgery was performed then.
Initially, when there is a diagnosis of melanoma, they are very much worried, thinking could it be treated, could it be gone, or is it advanced? But once we say it can be cured by the surgery and it is not much advanced, and because you came earlier, it's done at a curable stage, they feel very, very happy, and they feel it's good that they came here.
Well, they sort of tended to allay my fears. Said that once we've done this, you should be okay, but we'll do a follow-up and see what happens after that.
We are a complete holistic service for skin cancer. There is all aspects of skin cancer medicine available here, including scanning, surgery on-site, and all newer therapies like photodynamic therapy for precancerous lesions and solar damage. And enough information is given to the patients about sun exposure and protecting themselves against cancer. Overall, it's a holistic skin cancer center. In some of them, only scanning is available, and they are done by technicians, and the report comes from the doctors outside and takes some time, and there is no correlation between the clinical information of the patient and the doctor giving the report. In our case, the same doctor examines and reports as well. In some other places, surgery or other treatment is not available for skin cancer, only the diagnosis, whereas the patient has to go to a different center for the treatment. Whereas here we do everything.
when the doctor said, well, if you don't do something about it, we can't say what's going to happen. You mightn't have to worry about your Christmas presents, you mightn't be here. So the urgency was stressed to me, basically. I would fairly obviously say, well, don't muck around like I did. Get it seen to, basically. And obviously this place is what I'd recommend if they live here, so if I was not happy with it, I would seek alternatives.